Okay. Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So as of today, we have 9,508 cases cumulative since the beginning of the pandemic, which is up by 720 from when I reported a week ago. This is a 7% increase over the previous week, and that's a lower relative increase compared with the previous 2 weeks, and also lower than the provincial percentage increase over the past week at 17%. So if we look at the week of the 11th of April, beginning the 11th of April, we had 711 cases that week. The previous week, 666. The week before that, 451. And then the week before that, 308. And then the week before that, 260. So you see the upward trajectory that's been happening over the last 5 or 6 weeks. At this point in time, we have 1,141 active cases, which is up from 1,106 a week ago. We've had a total of 218 people pass away. This is an additional 6 people in the past week. And I do express my condolences to those who've lost loved ones in COVID-19. So they consist as follows: a woman between the ages of 65 and 79 from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a man 80 or more years of age from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, and a man 80 or more years of age from Simcoe County. None of these individuals had been immunized for COVID-19. We have a total of 47 people from Simcoe Muskoka in hospital, either located in a hospital here or out of district, up from 43 a week ago, including 13 people in the intensive care unit, which is actually down from a total of 16 a week ago. Their ages range from in their 40s to in their 90s. 35 are sporadic cases, 12 are outbreak-related cases. Over the weekend, we reported 281 cases, so this is from Friday through Sunday. Most of those were from Simcoe County, but 10 of them were from the District of Muskoka. 108 cases have been reported in the last 24 hours. They include 106 sporadic cases, 1 case associated with a workplace outbreak, and 1 in a congregate setting outbreak. 57 are male and 51 female. About 50% of them were under the age of 35. 107 of them from Simcoe County and 1 unknown at this time. 6 are acquired in the community, which means we don't know how they were acquired. 19 were from close contacts with known cases, 1 from a workplace outbreak, 1 from a congregate setting outbreak. 78 of them are under investigation, and 3 of them indicated as undetermined. We have 102 are in self-isolation, 1 hospitalized, 2 have recovered, and 3 are unknown. The great majority of our active cases reside in South Simcoe, so Barrie and Bradford, West Gwillimbury, New Tecumseth, and Innisfil. The weekly incidence of cases is as follows. So for all of Simcoe Muskoka, for the week of April the 11th, 119 cases per 100,000 population for the week. Bradford, West Gwillimbury had the highest weekly incidence for the 6th consecutive week, with the weekly incidence above 300 new cases per 100,000 population per week. New Tecumseth and Innisfil had weekly incidences above 200 new cases per 100,000 population per week. Agila, Toserantio, and Barrie had a weekly incidence of 100 new cases per 100,000 population per week. We continue to see cases that arose from gatherings over the Easter weekend. So 19% of the cases that have occurred since April the 6th have been associated with a non-household gathering or gathering with people beyond just the household. And remember that we do advise, and now it is required with the stay-at-home order, that people remain with their household only for close contact and not visit other households or not have other household members come into their home. And now with the stay-at-home order and the shutdown state of emergency, there's a prohibition against gatherings outdoors as well beyond household members. The only exception being individuals who live alone who would then adopt one other household for that kind of close contact. We had 41 cases of COVID-19 in childcare centers or settings. This is up from 26 a week ago. So this is cumulative since February the 8th when schools had reopened at that time. And 16 of these 41 cases were associated with outbreaks in these settings, the childcare settings, which is up from 14, so 2 additional ones in the last week. In terms of our variants of concern, as I've been indicating, we're having an ever-increasing proportion of our COVID cases be variants of concern. Last week, the week of April the 11th, 92% of our COVID cases have been found to be variants of concern. And so far this week, 100%, 24 out of 24 cases that have been tested were found to be positive as COVID cases. We have a total of 22 outbreaks happening right now, which is up from 19 a week ago, and 13 of these 22 are variants of concern. So right now we have 2 institutional setting outbreaks, which is down from 6 a week ago. The following are declared over as institutional outbreaks. The cardiac and renal unit at RVH, Mill Creek Care Center, and the Eldon of Bradford Retirement Home. We have 4 congregate settings, which is up from 1 as outbreaks. So 3 new outbreaks, 2 in group homes in Simcoe County and a halfway house in Simcoe County. We have 11 workplace outbreaks, up from 3 a week ago. So that's a large jump. So 11 new outbreaks located in a professional, scientific, and technical services location in Simcoe County, 2 in retail in Simcoe County, 4 in manufacturing, 1 food and beverage facility in Simcoe County, a repair and maintenance facility in Simcoe County, a construction site in Muskoka, a transportation facility in Simcoe County. And we have 3 that are declared over, a food and beverage site in Simcoe County, emergency services in Simcoe County, and a transportation site in Simcoe County. We now have no community setting outbreaks. So there were 2 a week ago, which have been declared over. 1, a real estate rental and leasing location in Simcoe County, and a personal service setting in Simcoe County. And we have 5 educational settings that are an outbreak, down from 7 a week ago. And just keep in mind that educational settings include schools, but also childcare centers. So we have 3 new educational settings as follows: St. Angela Marissi in Bradford, Collingwood Collegiate, and St. Marie of the Incarnation in Bradford are all new outbreaks. And I would point out that although schools are closed and have been closed for just over a week now, it is possible to identify outbreaks that date back to before they closed. So hence noting these locations. We have 4 that are declared over, 3 childcare centers in Simcoe County and the Alcona Glen Public School in Innisfil. In terms of immunizations, working with our partners to date, we've administered nearly 146,000 vaccine doses, up about 20,000 doses from a week ago. And some 23% of Simcoe Muskoka residents, or over 143,000 individuals, have received their first dose, with other individuals that have also received a second dose. So if we look at the percent coverage by age group, some 84% of individuals 80 plus have received their first dose, and 16.8% have received a second dose. For those 75 to 79, it's 80.4% have received a first dose. Those 70 to 74, some 70.6% have received a first dose. And then it falls off considerably for younger age groups. But we are making progress, I would say. The monitoring dashboard, the one that we as a health unit created before the province's framework, remains in red status, with virus spread and containment in red status. Laboratory testing is now down to red from yellow, and this is because of an increased percent positivity of 5.4%. Although that is down from a week ago at 6.9%. But we also have a testing turnaround has declined to 47.5%, whereas last week it was 54%, and the goal is greater than 60%. The healthcare system remains in yellow status, unchanged, and the public health system capacity remains in red status as we continue to be challenged in our ability to receive or respond to and notify new cases within the target of 1 day. The percent of new cases reached within 1 day over the last week was 75.7%, which is actually up from 50% a week ago, but below our target at greater than 90%. The province, of course, has indicated that we're in shutdown as of April the 3rd, the entire province in shutdown. As I'd indicated, our percent positivity has improved. It's come down to 5.3% from 6.3% a week ago. Compared with the province, which was 7.9% and up from 6.6% a week ago. And this is the 6th week in a row in which the province's percent positivity is rising. One thing I would note is that the percent positivity is increased quite substantially in Muskoka, and for the first time in this pandemic, the percent positivity is actually higher in Muskoka than it is in Simcoe. So Muskoka is at 6.1%, up from 4.0% a week ago, versus Simcoe at 5.2%, down from 7.1%. One thing I would also point out is our incidence of cases, as I'd indicated before, is up to 119.6 cases per 100,000 population per week. And that's an elevation from 112 the week before. The provinces went up substantially more than that. They're up to 206.7, up from 176.3 a week ago. So The difference between ourselves and the province is widening. The province is increasing at a more rapid rate than we are. Okay, so some key messages. A little bit more information about our vaccination rollout to date. We are certainly happy to receive pre-registration for people with high-risk health conditions. So people who have a body mass index greater than 40, and if they wish to look at how that is determined, they can go to our website about that. So that's the formal definition of obesity. Those who are receiving immunosuppressive agents, such as chemotherapy or immune weakening medications for their medical conditions, those with developmental disabilities, such as Down syndrome, would also be eligible with a high-risk health condition to receive immunization at this time. Also, one essential caregiver for any of these individuals would be eligible as well to receive immunization. So this would be people who, with these high-risk conditions, require regular and sustained assistance with personal care and or activities of daily living. So one individual who would help them with that. And so if these people have not already received their immunization from their hospital or their primary care provider, they can go to our website and pre-register in order to be booked to get vaccination at one of our clinics. We know that the province has now changed the age of eligibility for AstraZeneca vaccine. They've now made it adults 40 years of age and over, starting today. And this is available at participating pharmacies and primary care settings. Primary care practitioners that are participating will reach out to their patients in order to advise them of this and where they feel appropriate, book them for this, versus pharmacies where people interested would need to contact the pharmacy and book through their own booking system. Certainly, please have a look at our website or the provinces in order to determine which pharmacies are participating. And we also note that there's now a delay in 2 upcoming shipments of AstraZeneca vaccine from the province into the end of May. And so at this point, it's not clear how much vaccine is available at this time for people to be able to take advantage of this opportunity. We continue with a postal code, a forward sortation area in Bradford, West Gwillimbury. So the area of this community that falls into the postal code of L3Z as the first 3 digits, letters for their postal code would fall into one of the formally recognized hotspots of the province, the only hotspot that we have recognized in Simcoe, Muskoka. And at this point in time, we are supporting and providing vaccination to adults 50 years of age and older in this hotspot. The community is certainly actively participating in this. Local healthcare providers participating in this, and certainly the municipality, the town of Bradford, West Gwillimbury. So we've all come together in order to host and support clinics where we've had 2 extra clinics over the last week. And extra appointments are added to the regularly scheduled clinics on Friday and Saturday. So more than 1,900 eligible residents were vaccinated in these clinics. We have 2 extra clinics planned for this week and be continuing to add clinics and appointments as we work through this priority population. So once again, it's a reminder that this is residents 50 years of age and older who live in the L3Z area code for Bradford, West Gwillimbury. And of course, others who are otherwise eligible for vaccination We are sticking to that definition. So if others who don't meet that definition come, we will gently remind them that they're not yet eligible. We certainly encourage people to monitor our communication as things will unfold and change over time about eligibility. And we do ask that people not book more than one appointment at these clinics. So it's possible to book through the provincial system, and it's possible to book on our own website booking system. And with our own system, we ask that you not book more than one appointment. And if you've booked an appointment with the province and then want to use a booking that you've obtained through our own system, we ask that you then cancel the booking that you have on the provincial system. We're also working to vaccinate agricultural workers in Bradford, West Gwillimbury, including those that are temporary foreign workers, but we've also immunized other agricultural workers as well. So we've immunized We've immunized 106 agricultural workers in total in Bradford, West Gwillimbury. We have 2 clinics that are planned for this group this week, which will provide vaccination for up to 600 workers, first one happening today. The week of April the 18th to 24th is National Volunteer Appreciation Week, and certainly we are appreciative of our volunteers, and we definitely want to commemorate their contribution. The theme this year is the value of one, the power of many. And we want to recognize the 260 volunteers who've given us their time and their effort to support COVID vaccination and clinic operations throughout Simcoe, Muskoka. So they enhance our ability to provide extra clinic to provide excellent client experience by monitoring the waiting areas, assisting and directing clients, disinfecting and cleaning surfaces at community clinics across our district. Our clinic volunteers have one thing in common: they want to help and serve others. They bring a wealth of knowledge gained through previous volunteer involvement, and as current or retired nurses, teachers, police, allied health professionals, business executives, event planners, students, public servants, government employees, and community citizens. We also appreciate the valuable contributions of our community partners who are providing support with volunteer coordination, and this includes Georgian Bay General Hospital, Matthews House Hospice, and Aurelia Soldiers Memorial Hospital. And we are certainly grateful for the support of each volunteer and our many community partners as we work together to protect the health of the residents of Simcoe, Muskoka. We've revamped our health stats website. We reorganized the information about COVID-19 on that health stats site and its pages. In particular, we now have transitioned to a multi-paged format, whereas previously all the information was posted on one page, and this has helped people to navigate through the information better. So with this new format, each topic heading is now linked to a separate web page and helps cut down on the length of content on each web page. Multi-page format is more user-friendly and easier to navigate. We have some results up from a local impact survey. So this was conducted in November with over 2,000 participants. And certainly invite people to have a look at this on our COVID local impact survey page of health stats. And some highlights are as follows. The vast majority of local residents, 95%, think the pandemic is very serious or somewhat serious, with a greater proportion of older adults, 65 plus, saying they perceive the pandemic as very serious. Most local residents follow public health recommendations, especially in indoor public spaces, more so than compared to private gatherings, which remains perhaps a challenge for people. And I think takes us back to the pattern that we've seen of some transmission related to this, other transmission related to work environments. So older adults were most likely to follow public health measures. People are concerned about the indirect impacts of the pandemic, such as on the economy, personal income, mental health, social and recreational activities, as they are about the direct impacts of the pandemic. Parents are as concerned about the indirect impacts of the pandemic on their children, such as academic success, screen time, mental health, social isolation, as they are about their children's likelihood of becoming sick from COVID-19. Many residents have experienced worsening mental health, particularly young adults aged 18 to 34 years. And women, substance use generally has been found to be increased among those who use substances. The pandemic has had impacts on physical health, with most residents reporting either no changes or negative changes to health behaviors such as sleep, physical activity, and screen time. Many individuals and families are having more difficulty meeting their basic needs, with adults under 65 having more difficulty compared with those who are over 65. And residents have some hesitancy about becoming immunized. The good news is that some 68% of residents indicate that they will probably or definitely get immunized, but some 28% they will indicate that they probably would not get vaccinated, or that they're unsure whether they would get vaccinated. I think that this is a very important point, because we do need to get high immunization rates if we're going to achieve herd immunity and break the chain of transmission and get a good control of the pandemic. So I think that one is an important point for us to take to heart as a health unit, and further work that we need to do to increase acceptability and reduce hesitancy about immunization. So it is reaffirming to see that most local residents have responded favorably to the work of the health unit during the COVID pandemic. And so we invite you to have a look at the results. And also I'd like to commend people who've participated in our most recent survey, which was just closed. So some 2,600 people have participated in that. And we will get results out on that once the analysis is completed, which will take about 2 months. So some media questions are as follows. Are you advocating for safe outdoor sports and recreational activities for children? Many children are suffering, especially with the recent closure of schools, and are even willing to wear masks outdoors. So what I would say is, it's very important for all people, and in particular for children, to be physically active and to get outdoors. And the stay-at-home order does recognize that physical activity is an essential reason to go outdoors. It does, however, prohibit gatherings beyond household members. So the activities need to be with the household, otherwise on their own. I was happy to see the province allow, again, the use of play structures. And I think that the use of parks in neighborhoods is key. Resources in the immediate neighborhood are key for all of us to be active, for children to be active, for us to get access to some green space and exposure to green space. But at this time, it is important that we stick to our household and otherwise not have gatherings with other individuals, to avoid that kind of congregating that can lead to transmission while we're very much in the third wave. So as things come under better control at some point, of course, the province would be looking again at what to do with regards to allowing more group-like activities and gatherings and sporting activities. But at this point in time, the activities that we need to be doing are more household and individual based. Why did the eligibility to receive the AstraZeneca vaccine suddenly drop to 40 years of age and older? Could this be because these vaccines are approaching their expiry date? And if so, is that safe? Well, this was a decision made by the province, so I don't have like an inside story on this. I do know that, in fact, Health Canada has authorized the AstraZeneca vaccine to be used 18 years of age and above. the National Advisory Committee on Immunizations have been recommending at 55 years of age and above, but are reviewing and we're expecting possibly a change in that recommendation. I do know that other countries have gone with different age categories, such as the UK of 30 and above. And I do know that there is certainly a need for us to get people immunized. We have a high rate of transmission among younger people. It's older people that tend to suffer much more an incidence of severe disease, but younger people can also have severe disease. The variants of concern have raised the possibility of all of us having more severe disease, including younger people. So AstraZeneca is certainly an opportunity to vaccinate more people. Moving to 40 years of age allows more people to be able to get immunized. I do know that, of course, there is an expiry date on vaccines, and there is the need to not waste any vaccine during the pandemic. Every vaccine is an opportunity to avoid a case and save a life. When will the Bradford hotspot eligibility be expanded to any adult age 18 or older, like some other hotspot areas have been doing? So in Toronto and Peel, there has been a movement to expand at least some of their hotspots to have younger individuals vaccinated, essential workers vaccinated. We, as a health unit, are looking at the potential to move. Certainly, we want to move in that direction. We probably want to do it more of a staged approach, moving to another age band before going right down to 18, just to manage the volume of vaccine that would be required and to have it available to those who are a little older and more likely to have severe disease and therefore a greater need to be immunized. But we're monitoring what the uptake is of the vaccine now for 50 and above and the amount of vaccine that we have. And we are also looking at large employers in that area with regards to when we get to the point that we're vaccinating more broadly younger age groups, that we would also be looking at how to facilitate immunization of essential workers, including the potential to do so in their workplace. What is your opinion on the safety and risk associated with golfing and other outdoor recreational activities? If public health protocols are being followed, can you recommend on the importance of getting outdoors and getting exercise while stay-at-home orders are in place? So this is akin to the question that I had before, only I think it's a little broader, talking about others, not just children. So as I'd indicated, physical activity is very important for us all. And the stay-at-home order recognizes physical activity as an essential activity. It also requires people to stick to their household for gatherings, both indoor and outdoors. And so the activities that we need to be doing at this time are more household and individually based. And therefore, other recreational facilities may more lend themselves to larger group activities, which we want to avoid. I understand that golf has been included at this time to prohibited. That was a choice by the province, and so I would not really have a specific understanding as to exactly the rationale, but it could be cited as being related to discouraging gatherings and the coming together of non-household members at this time. How will expanding AstraZeneca vaccine eligibility to adults age 40 and up impact local efforts to control the spread of COVID-19, and how does this impact efforts to vaccinate essential workers? So I would say that moving to a younger age group, so 40 and above, covers a larger proportion of the population. And therefore assists with the protection of more people, younger people, including at least those essential workers that are 40 and above. They would now have the opportunity. I do note that opportunity is limited with the delayed shipments, which is, of course, very unfortunate. But it creates more of an opportunity to vaccinate more at-risk people by being able to go to a younger group. What proportion of local cases are among those 40 and up? So in Simcoe, Muskoka, some 47% of our cases more recently are 40 years of age and older. There have been suggestions to reduce the eligibility age to receive AstraZeneca vaccine further. What are your thoughts on that? Well, I think it's really important, considering the concern about the very rare but serious health outcome of the clots and platelet abnormalities that have occurred in the range of 1 in 100,000 to 1 in a million associated with this vaccine. And this matter is under active review by the National Advisory Committee on Immunization. So, and also Health Canada. So I would want to be taking our leadership from their conclusions. It would be helpful, of course, to be able to expand this to an even younger age group if we can do so, if it's deemed to be safe to do so in order to reach a larger proportion of the population and offer them the immunization. But regardless, it is going to take us weeks and months to be able to offer immunization through the priority groups to all who are eligible for the first dose and then their second dose. It's going to take the full range of vaccines that we have and working through those priority groups and all of our venues to carry that out over time. And in the meantime, people need to continue protecting themselves, whether they're vaccinated or not, with the public health measures, following the stay-at-home order, wearing a mask when in indoor public places and workplaces, physically distancing, self-monitoring, seeking testing with symptoms, and of course, hand hygiene. Are there any plans to reprioritize essential workers such as teachers, grocery store employees, and manufacturing facility staff for vaccination, especially in areas in South Simcoe that have been hard hit by the pandemic? And I would say that certainly we want across the board to get to essential workers. We are working through our priority groups across the board throughout Simcoe, Muskoka, and across the province. And essential workers are in phase 2, in the latter part of phase 2, after reaching others, such as vulnerable patients with high risk or very high risk, moderate risk health conditions, people living in congregate settings such as group homes. And we do note group homes have been hit substantially with outbreaks during our pandemic waves. We certainly want to be able to get to essential workers after getting through those groups. But there's also our hot spot in Bradford, West Gwillimbury. And in that location, we are, as I've indicated, working through those that are 50 and above and looking beyond that, planning beyond that to be able to do younger adults and workers, which would include the essential workers, such as the ones cited in this question. What are your thoughts on the federal government's offer to send help to Ontario? Do you think this is warranted given the current situation? So I would note that this is an area that I have some knowledge of, but I don't work in acute care. And so this would be a matter, I think, that others would be able to speak to with more authority, those who work in hospital, those who are providing leadership in hospitals and tertiary care. But from my work with the Central Region of Ontario Health on their response and recovery table, I certainly get reports of the dire situation in hospitals, particularly in the Greater Toronto area at this time, with a tremendous load on their intensive care units and a great number of patients being transferred out of the Greater Toronto area to neighboring districts, including here in Simcoe, Muskoka, including intensive care unit patients, in order to manage the load. I also note the province's directive allowing for the movement of healthcare workers to where they would be needed to assist in the response. I'm aware that paramedic services in particular is extremely taxed in the movement of these patients, as well as just keeping up with their normal 911 responses. The system is taxed like it has never been before, and any efforts to procure additional assistance at this time would be warranted.
Thank you so much, Dr. Gardner. We will now open it up for questions from the media. Just a friendly reminder to please limit yourself to one question and one follow-up to ensure that everyone has the opportunity to participate today. And please remember to unmute and mute yourself. Can we start with Chris Simon from the Barrie Advance? Do you have a question for Dr. Gardner?
Yes, thank you very much. Dr. Gardner, it seems like, well, it doesn't seem like, cases have risen so dramatically over the last couple of weeks. Has this caught you off guard, and what does it do from an operational perspective to the health unit?
I would say that I was fully expecting a third wave, that I positioned my concern about that back in February, that I did what I could to forestall it, including with a request in late February for us to go into lockdown. In particular, I was concerned about the very high prevalence of variants of concern here in Simcoe, Muskoka that arose with our facility outbreaks in January. So I was expecting it. We've done all that we can to prepare and manage it, having gone through 2 previous waves and an unprecedented amount of recruitment of staff and orientation of staff. A great deal of that has had to go to immunization, and that is the way out of the pandemic in the medium term and in the long term. And so we've had to maintain our resourcing there. And so although we put more resourcing into case and contact management and outbreak response, it's still been a challenge. We still find ourselves having difficulty keeping up with the cases, even though we're also using the province's human resource system to manage 30% of our cases as well. We still find ourselves challenged. And
I'm sure you've seen what Peel and Toronto Public Health have put out in terms of closing down workplaces who have 5 cases within 14 days. Is anything similar to that being considered here?
I think I need to consider all ideas that arise in the field from my colleagues, and certainly those that are much more beleaguered are more likely to come up with such ideas before we do. Peel and Toronto carry the lion's share of cases and incidents of cases and outbreaks in the province and have throughout the pandemic. I know from my communications with them that they are extremely challenged in being able to keep up with their outbreaks. And so this would be an approach to managing that when in fact your ability to keep up with it is challenged. So I take it under advisement. We consider all ideas.
Thank you.
Welcome.
Mark Bruneman from Barrie Today, do you have a question?
I do. Thanks so much for the opportunity. Sorry. Can you tell us a little bit of what you're anticipating with the flow of the vaccine to Simcoe, Muskoka, both the AstraZeneca and what the health unit is managing?
Thank you for that. It's, I'd say, challenged at this time. We've had Moderna being delayed and reduced in half, and now the AstraZeneca postponement. I'm aware that there's been the procurement of additional Pfizer vaccine, and we have been told to expect more Pfizer vaccine in early May. So that's a good thing. We'll see the degree to which that compensates for the AstraZeneca and the Moderna. So far to date, we still have had maybe half of the volume that we would be capable of administering if we were to receive it. We look forward to the day in which we get much bigger volumes, but we don't know when that will be.
And could you also touch on what you anticipate the impact on the local cases will be now that 40 plus can access the AstraZeneca?
I believe that immunization is important, undoubtedly, to control the pandemic. I believe that its impact on the third wave will be felt at the tail end of the third wave, rather than bringing it under control at its peak, because we haven't vaccinated enough of the population, and we don't have enough of it flowing rapidly enough to be able to achieve an impact right away. So its impact is going to be more on the tail end, and it will definitely be there to maintain control to come. One could contemplate the possibility of a fourth wave, particularly in the fall. And the likelihood of that in part will depend on how well we do about immunization and whether or not we can achieve herd immunity with a sufficient coverage of the population as a whole. The AstraZeneca moving to 40 probably won't make a difference to that trajectory, especially when you consider that there's been this postponement now in its shipment to the end of May.
Thank you.
You're welcome. I guess my bottom line with that is we've got to maintain all the other control measures, both individually and collectively.
Don Huddlestone from the Huntsville Doppler. Do you have a question for Dr. Gardner today? Okay. Erica Engels from Collingwood Today. Do you have a question?
Yes, thank you. Dr. Gardner, I'm not sure if you've seen it, but the Ontario COVID-19 Science Advisory Table released a brief today saying, you know, this should be the way forward, this is what will work. And then they list 6 things to reduce transmission. They say, we know the following 6 things will reduce transmission. Among those is 2 points include focusing on public health guidelines that works. And in there, they say it means Ontarians can spend time with each other outdoors, distancing 2 meters, wearing masks, keeping hands clean. And it goes as far as to say that Ontario should be allowing small groups of people from different households to meet outside with masking and 2-meter distancing. And that policies that discourage safe outdoor activity will not control COVID-19. And I just wondered what your comment is on this note from the Science Advisory Table.
I have, the highest opinion of the Science Advisory Table, and they have certainly helped tremendously throughout the pandemic. They've been absolutely essential in their work. They have other advice in there as well that I think that's very important, such as addressing workplace safety and identifying what are truly essential workplaces to be maintained versus others that aren't. I had seen a draft of their document before it went out. Also, they speak to the importance of, if I recall correctly, sick leave pay, which is a position that our Board of Health has supported as well, to enable people not to go to work when they're sick. And we look at the number of outbreaks that are going on right now here that are workplace related. I think that's a critical point. I agree with them that outdoor activity is very important for people. I agree that if we were able to maintain people being 2 meters apart, and if not that, then in use of masks, that could be done safely outdoors. I also think, though, that messaging alone is not sufficient for influencing people's behavior, that people need supports and to some degree legislative requirement in order to help shape behavior. We've had to work with municipalities all along about that. If you think back to summers, there was a lot of work that was done to help people use beaches in a safe way, to require people to be distancing from others that weren't part of their immediate group. And that required patrolling of beaches and enforcement. So if you're going to go, you have to give thought to that with policy. If you simply advise that people could get together but maintain distances apart, that in itself may not be successful. You will have a certain amount of people coming in contact with each other and not maintaining the distances, not using a mask when they do so. We've also had some increase in our community transmission rate here. So it's up at 30% now. It's usually in this area between 20 and 25. Those are cases that we don't know how they were transmitted. And so it leaves us asking the question, to what degree could that have happened with unmitigated encounters, including those outdoors? So I mostly agree with the science table. I do think that the question of exactly how you manage outdoor exposure at this time is open to debate.
Okay, and further to the point in the same brief about essential workplaces, I mean, they say this means permitting only truly essential indoor workplaces. You announced today there's 11 new workplace outbreaks this week.
Yeah.
I mean, how many of those would you consider truly essential workplaces, and what difference would it make in our region if you did do something, if you were a little more strict on what is truly an essential workplace?
So that's a tough question. I mean, we see a lot in manufacturing and in offices, right? And one could argue that at this time, one doesn't need a lot of the office services that are taking place, or that they need to be done remotely only, all work done remotely. And in fact, right now, the requirement is that any work that can be done remotely needs to be done remotely. We do know with those outbreaks that there were lapses in compliance with the legislative requirements, the screening of employees, or having a comprehensive plan for COVID safety can be missing, or having individuals there that didn't need to be there. So to some degree, this is a matter of compliance with the requirements that are already in place. But if in fact the province were to go further and identify that only a very limited number of work environments truly need to be open, it's possible that many of those places would have been closed and therefore wouldn't have had outbreaks. I think that kind of thing is best done by the province. I think it would be very difficult for a local medical officer of health to be able to identify which manufacturing facilities should be maintained and which ones should not, what type of office services should be maintained or not. It would certainly be open to a tremendous challenge if a local medical officer of health were to try and do that.
Thank you very much.
You're welcome.
Brett Glover from Barry 360. Do you have a question for Dr. Gardner?
Actually, my questions have all been addressed today. Thank you.
Great, thanks. Mary Beth Hartle from Muskoka Region.
Yes, thank you. I just have one. So for the first time in the course of the pandemic, outdoor funerals, and of course we're in interment service time, have gone from 50 down to 10. In your opinion, do you think this is necessary?
I think that it's necessary. I think this is the worst wave we've had, the highest prevalence of transmission that we've had, the greatest risk with variants that are more severe and impacting at younger ages as well. With a hospital system that is overwhelmed, I think we need a comprehensive approach that really restricts the amount of up-close personal interaction that people have outside of their households, and that would be part of such an approach.
Okay, thank you.
You're welcome.
James Bowler from Cogeco, do you have a question for Dr. Gardner today?
I do. Thank you. Dr. Gardner, I heard a story this week from a Huntsville resident who went on the Ontario website to set up for the vaccine. She was sent to Haliburton, and then she heard from somebody who she knew in Haliburton that was sent to Huntsville around the same time. So I feel like there's a bit of confusion on where people should, first of all, be signing up for these vaccinations, and also, should there not be a little more, I guess, cohesion between the province and the health units in terms of not sending people to other health units to get vaccinations?
Well, thank you for the question. If she was booking based on age, then indeed it's the province's website that does the booking. If it was one of the other priority groups, then there's a pre-registration process on our website, or it can be done. It gets complicated. It can be also done, if it was like a medical condition, it'd be done through the hospital that provides the care. But anyway, if it was based on age, then the province is the way in which it's booked. And it works preferentially by offering what's available in their immediate locale first. And if that's booked up, then farther afield or farther in the future. And I would say right now that we are heavily booked throughout April and into the first week of May already. And so to be able to book in one of our clinics now really requires you to be booking into mid-May at this time. So that might have been part of what was happening with this person having to go somewhere else. And other than my general comments, I don't really have an explanation as to why she had to go to Haliburton and somebody else had to come here, had to go, to Huntsville. I wouldn't be able to definitively give an answer to that.
Thank you. My other question is around mental health. I'm wondering what concerns and maybe what solutions the health unit specifically might have in terms of dealing with a lot of the mental health issues that are being brought forward right now due to the lockdowns, due to the over a year of COVID-19 restrictions. There is a lot of conversation now about stress, anxiety, and PTSD. What can the health unit, I guess, be doing outside of other organizations that deal with mental health to help balance this? Because I know there's a lot of focus for COVID for you guys, but there are other areas as well.
There's no doubt that there is a major impact on people's health and well-being in general from the pandemic, and not just from COVID-19. And part of that impact is mental health, and part of it is substance use that's gone up. And that this can affect children as well as adults, and that we've seen that kind of self-reporting on our own survey. And we do, have information on our website about these impacts from other studies and our own research. So that's a resource for people. I would encourage people to seek out mental health support services that exist in their community. I know that they may be challenged in getting them at this time because of the heavy use and because a restriction of people being able to go into facilities. It would probably turn out to be a remote service. In general, I would encourage people to do what they can for self-care. So getting out and being physically active and getting access to green space and engaging with your household members. And if you live alone, adopt another household and use them as your household for close contact. Take advantage of that to the best of your ability. Take advantage of remote communication with other loved ones in your life. But I must admit, I do not have a strong solution for this issue.
Thank you.
You're welcome.
Mark Claremont from Muskoka Today.
Yes, I'm happy to report that I got the vaccine last Friday in Minden, it took me 5 minutes on the provincial phone line to get to book the appointment. And I hate to say, but I did get the Pfizer vaccine, so I was happy about that. So this afternoon, Dr. Gardner, the province has just announced that it's going to implement some form of sick leave program. How do you feel about that? And will that help reduce the cases?
Well, thank you for that information, and congratulations on getting your immunization, and commendations to you, because it's not just good for you, it's part of the broad solution. You protect yourself and you protect others, so congratulations on that. I had not seen what you've reported, and I appreciate you letting me know. It's hard for me to prepare for these interviews and then be up on something that's just come up. So I look forward to reading about it, but I'm sure it's positive news regardless. And allowing people to have the support, the financial support they need to avoid going to work while they're sick is very important as a way of reducing transmission.
Okay, and speaking of keeping up with news, I don't know whether you saw a clip or a news item in Muskoka, specifically in Gravenhurst, the last day or two, regarding the police enforcement at a skateboard park, and like an officer shoved a 12-year-old boy who didn't have a mask, and there was some kind of confrontation. The province has had an awful lot of difficulty extending its messaging. And how do you feel about that? And how do you feel about the police using their powers arbitrarily and not in keeping with public good order, I guess?
Thank you for that. I will look that up. I would say that these are really difficult times. And first and foremost, we need to all be patient with each other and kind to each other, and think to the objectives that we're trying to achieve. And when it comes to any restrictions, the objective is to protect people, protect each other, and to take a progressive and gentle approach with enforcement, starting with education and being respectful of people, certainly respectful of their safety.
Anything more you'd like to add?
I would need to read the article.
All right, thanks.
You're welcome.
Thanks, Mark. Trina Burlow from the Creemore Echo, do you have a question today? No. Okay. And Mike Arcelides from CTV Barrie, one question, one follow-up.
I promise. Okay. Doctor, how are you?
I'm doing okay. How are you doing?
Hanging in there. What isn't working right now? Because, you do something for a year and we're back at square one, so to speak, or even worse than square one, if that's possible. What should people be doing right now that they're just not doing?
Well, first off, I would say that although we find ourselves in a third wave, we've succeeded in protecting most people. Most people have not become cases of COVID-19 that we have prevented through our collective efforts. Many tens of thousands of cases throughout hundreds of thousands of cases throughout Simcoe, Muskoka, and many, if they had occurred, they'd be many thousands of deaths that would have occurred. And that has been a direct result of our individual and collective efforts. So on the one hand, we're into the third wave. On the other hand, we certainly avoided that kind of a worst case scenario. I would say that I had said in February when we came out of the shutdown that it was premature and that the province was choosing to take a risk about the potential for a third wave. So I stand by that. I believe that we would have a different situation today with a different course of action at that time. I would say that we collectively have done an incredible job in having vaccines in less than a year from the beginning of the pandemic, that the projections at the very beginning of the pandemic were that it would be at least 2 years before we would have vaccines. And so we're well into immunizing the population. It's a great challenge to do so and to get the volume that you need, but we're making very good progress on it regardless. And I fully believe in the end we'll be in a much better place into the summer because of it. I think the take-home messages for us for a time to come, and it could be a very long time to come, is that we need to be mindful of this virus, its ability to transmit, that it's respiratory, that we have to maintain physical distancing from others out of the household, that we need to be using face coverings in indoor public places and workplaces, that we have to do excellent hand hygiene and self-monitoring. That will be with us for some time to come.
And following up on that point earlier that was raised with regard to Peel and Toronto going forward with that Section 22 order, would you be compelled if, let's say, not to name any names, but the Honda plant had 50 cases this week, would you be compelled to say, you know what, guys, we're going to take a break for 10 days?
I would say that what's happening in Toronto and Peel right now is the result of them being very challenged with their caseloads and their outbreak load to keep up with it all. And so they're using this as a stopgap measure. I think that as a health unit, we need to look at whether or not we get to that point, that we need to take that approach. But until you get to that approach, our standard is to work with facilities and to decide what is needed with an outbreak in a facility to bring it under control. Closure is an option, but it wouldn't be an automatic option.
Okay, I'm done. Thank you.
You're welcome.
Thank you. Is there anyone on the line that I've missed today that has a question for Dr. Gardner? Okay.
Can I ask one more question, if you don't mind?
Certainly, Mark. Go ahead.
Dr. Gardner, when are medical officers of health going to turn their backs on the province and stop acting like civil servants and start acting like professional doctors and adhering to the Hippocratic oath to do no harm?
Well, I would say that you've positioned your question in a challenging way. I would say that I am a physician and that I am completely dedicated to my professional work and the protection of this population, and that I certainly have taken action that was very hard to do. One striking example was essentially positioning to have this district in lockdown at the end of February. That was exceedingly hard to do. I felt that it needed to be done, even though the numbers in the framework wouldn't have supported it. I went there because, in my judgment, we are at an added risk with the new variants, and that we are in a class of our own, having far more than anywhere else. So I'm completely committed to protecting this population.
Yes, it was asked in all due respect, but I think I discussed with you once before about unilateral ability in your job.
Well, that would be a different matter from dedication. So I'm fully dedicated to protecting this population, but I have limited power to do so. I exercise the power that I have and apply it where I think it's needed and would be effective. But I don't have the same degree of power that the provincial government itself has. And they would be able to successfully or more successfully do things than I could. Even with the lockdown that happened at the end of February, that was done under the province's power. I exercised the influence I had, but it was their power that made it happen.
Okay, thanks very much anyway.
Welcome.
Thank you so much, Dr. Gardner, for your update this afternoon. And I'd like to thank everyone for joining us today. And that brings us to the end of our media briefing.
Thank you, everybody.
Thank you.
Thank you.
Thank you.